This podcast is going to deal with the bone marrow. Bone marrow is, of course, the tissue involved in hematopoiesis. And at the outset, I'd like to make this point for you. Bone marrow is a remarkably productive tissue. So, for example, bone marrow can produce 200 billion red blood cells per day. It can produce 100 billion white blood cells in a day, and it can produce 400 billion platelets in a day. So a very, very active tissue. Now, we have seen this slide in earlier presentations that relates to the monophyletic theory for the origin of all of the cells that are in peripheral blood. And as you know, most of these cells are developing in the bone marrow from a hematopoietic stem cell, a common progenitor stem cell. And as that stem cell differentiates, it undergoes various types of committed pathways. And we sometimes give the committed stem cell the name colony-forming unit cells. That's not something that you really need to remember. I just mentioned it because you may see that in your reading. This slide just reminds you of the fact that bone marrow begins to become active at about the 4th month of fetal life. By 5.5 months of fetal life, the bone marrow is becoming more active in hematopoiesis as the other embryonic hematopoietic tissues are declining, and the bone marrow is maintaining a steep increase in its ability to undergo hematopoiesis. And by birth, of course, the bone marrow is very active in hematopoiesis. In bone marrow, the red marrow is considered the marrow that's active in hematopoiesis. Yellow marrow, sometimes given the name fatty marrow, is inactive. Throughout fetal life and at birth, bone marrow is red marrow. It will be gradually converted to yellow marrow as the individual gets older, but that conversion is reversible. In adults, most of the bone marrow is yellow marrow. However, bone marrow does remain active in hematopoiesis in the epiphyses of the long bones, in the skull, in the ribs, in the iliac crests, and the sternum. And as we said, yellow marrow can readily be converted to red marrow if the need should arise. Now, let's consider bone marrow as an organ. Blood will reach the marrow by arteries, which are going to traverse the bone before supplying a sinusoidal capillary network within the marrow space of the bone. Blood will leave marrow through a central vein which drains the sinusoidal capillaries. Blood cells, macrophages, and platelets can cross the endothelium in the walls of the sinusoids. Now, marrow is essentially the stromal cells plus the developing clones of various blood cells. And it turns out that erythrocyte clones and megakaryocyte clones are closest to the sinusoidal surfaces because those cells tend to be non-motile cells, whereas the granulocyte clones are deeper into the sinusoidal spaces, further from the endothelial cells, because those cells tend to be motile. And this is just a schematic diagram of bone marrow. So you can see erythropoietic clones, one here drawn, and a megakaryocyte, these being close to the sinusoidal wall, whereas the granulopoietic clones are further from the sinusoidal wall, as these cells would be motile. And then in the diagram, one can see the endothelial cells here, another endothelial cell here with a nucleus shown here, and then the stromal cells in bone marrow. And notice that these stromal cells put out long projections that kind of surround the developing clones of cells. This is an electron micrograph of what we just showed you. So here I'm tracing the wall of a sinusoidal capillary in the bone marrow. Here would be some mature erythrocytes in the sinusoid. Here would be a reticulocyte. Here would be a couple of platelets. This would be the endothelial cells that make up the walls of this capillary. Here would be a reticulocyte in the bone marrow space proper. Another reticulocyte here. This cell would be in the granulocytic series, and here would be a cell in the lymphoid series. The stromal cells can be reticular cells, adipocytes, and macrophages. But what is the role of the stromal cells? And here we're considering the role primarily of the reticular cells. These cells secrete cytokines, such as interleukins, and various growth factors, such as, for example, fibroblast growth factor, and various colony-stimulating factors that are going to stimulate and regulate hematopoiesis. Basically, the stromal cells provide homing sites in a uniquely specific environment or niche for blood cell development. And so the diagram is just showing what we believe might happen. Here is a stromal cell in the bone marrow with one of the stem cells, and just showing signaling from the stromal cell to the stem cell. And you might imagine this will cause the stem cell to differentiate and may become a committed stem cell to one of the colony forming units, or the stem cell will just be maintaining itself as a population of undifferentiated stem cells. The granulocyte precursors make up about 60% of the cells in marrow. About 20% of the cells in marrow would be lymphocytes and lymphocyte precursors, monocytes, megakaryocyte precursors, and stromal cells. And then another 20% of the cells in bone marrow would be the erythrocyte precursors. These percentages relate to differences in development times and lifespan of the mature cells. And the little table at the bottom shows you, in general, granulocytes have a lifespan of something less than 10 days on average, yet they take about 14 days to develop in the bone marrow. So the mature cell has a lifespan of something less than 10 days. Erythrocytes take about 3.5 days to develop in the bone marrow. They have a lifespan of approximately 120 days. Identification of cells in bone marrow is not easy. It will take many years of training to become expert. So what do you have to know for our course in relation to identifying cells in bone marrow? Well, let me talk first about the developing white blood cells. There will be a myeloblast or a stem cell, and we're not going to expect that you will be able to identify that. We will expect you to be able to identify a progranulocyte, and by the way, progranulocyte is the same thing as a promyelocyte. I actually prefer the term promyelocyte, but you'll see the term progranulocyte used more frequently. So we'll want you to be able to identify the progranulocyte, promyelocyte. We'll want you to be able to identify myelocytes and metamyelocytes, and we're going to also ask that you can distinguish between neutrophilic myelocytes and eosinophilic myelocytes, and likewise between neutrophilic and eosinophilic metamyelocytes. We'll then expect you to be able to identify band cells, stab cells, and finally mature neutrophils or eosinophils. And we'll also expect you to identify megakaryocytes within the bone marrow. These are very easy to identify, as you'll see. We're not going to ask you to identify any of the cells that are basophil precursors in bone marrow, nor will we ask you to identify any of the lymphoid precursor cells in bone marrow. We will talk later in this podcast about the cells we'll expect you to identify as far as for the maturation of red blood cells. Let's talk about granulopoiesis, or the development of white blood cells in the bone marrow. First of all, there's a marrow reserve of granulocytes that may be 15 times greater than what you'd find in the peripheral blood circulation. We can talk about the mitotic or synthetic phase of granulopoiesis. That takes about 4 days, and it's primarily involved with granule synthesis. And we can identify the progranulocyte and the myelocyte. And the myelocyte will either be a neutrophilic or an eosinophilic myelocyte. Of course, there'll be basophilic myelocytes, but you don't have to identify those. Now, the progranulocyte will have a very large euchromatic nucleus. You may see some prominent nucleoli, and there'll be nonspecific or lysosomal granules. These nonspecific or lysosomal granules take on this deep purple color. These are the so-called azure or nonspecific granules. Here you can actually see maybe 2 nucleoli. This cell will then differentiate into the myelocyte, and it will either be a neutrophilic myelocyte, which are shown here, neutrophilic myelocyte, or eosinophilic myelocytes, which you don't see on these series of pictures. The myelocyte, the nucleus is going to become more round, whereas in the progranulocyte, the nucleus is a larger oval shape. Here in the myelocyte, the nucleus is a more rounded shape. It's more pycnotic or condensed, and you'll begin to see the appearance of specific granules. Here at the tip of my pointer, I'm highlighting the neutral colored granules. These are the specific granules. You'll also see a Golgi halo. Here, a very prominent Golgi halo, and it's shown here very nicely, the Golgi halo. Remember, in the white blood cell differentiation, you're making granules. Granules are membrane-bound structures, so you're going to have a lot of rough endoplasmic reticulum and an active Golgi complex. We can continue in the granulopoiesis series, the post-mitotic stages. That lasts about 10 days. There's decreased synthesis. Of course, there's no mitosis anymore. There are dramatic nuclear changes. So we can recognize a metamyelocyte. You'll begin to see a nuclear indentation, shown here or shown in the diagram like this. The nucleopycnosis will be increasing. You'll have a band cell, which will be the next stage. The arms of the nucleus will tend to be parallel. The nucleus itself will be even more pycnotic. And finally, as the cell gets more mature, you'll see an increased lobation in the nucleus and even more nucleopycnosis. Now, here in the diagram, we're just showing the metamyelocyte perhaps going directly to the mature eosinophil with the bilobe nucleus, whereas going from the metamyelocyte to the mature neutrophil, you'll find these intermediate stages more commonly. So you'll find a band stage, and maybe even sometimes you'll hear the term stab stage. So here's a metamyelocyte. Here's an early band cell nucleus. Here are some later stage band cell nuclei. Band cells here, and a band cell here. This would be an earlier cell, probably late myelocyte stage, not quite a metamyelocyte yet because I don't see the nucleus indenting. Here is a mature neutrophil. Some cells here, a promyelocyte or progranulocyte. You can see these non-specific granules. Here's one actually dividing, so a division figure. Here is an eosinophilic myelocyte, the rounded nucleus, the very distinct eosinophilic granules. Here is a neutrophilic myelocyte. I can see the neutral color granules here. And then early and a little bit later neutrophilic metamyelocyte. I can see the Golgi halo, and I can just begin to see the indentation of this nucleus. And then this would be a fairly late stage of a stab cell, or almost a mature neutrophil. Here are cells in the neutrophil series, maybe the earlier band stage cells, maybe this one, and then a little bit later stage band cell or stab cell. Now, there'll be some cells that you're not going to be able to identify so readily in bone marrow. So, for example, I don't know what this cell is. This cell is likely in the red blood cell series, but I wouldn't expect you to identify that on this micrograph. This cell is probably in the red cell series, but again, I'm not going to expect you to identify that in the micrograph. The cell here, there's not enough information on the micrograph for me to really know what that is. Let's talk about a summary of the trends in granulopoiesis. We can say the nuclei decrease in size, they become more pycnotic, they become more lobated. So as they're decreasing in size, their function is decreasing. That is, the transcriptional activity off of the genes in the nuclei are decreasing. Granules will appear first as non-specific or azure granules and then as specific granules. By the way, the non-specific granules are typical lysosomes. The specific granules are going to take on the staining characteristics of the mature cell. So the specific granules are either going to be neutral colored with respect to the neutrophil precursors. They're going to be eosinophilic or orange colored with respect to the eosinophils, or basophilic or deep blue color with respect to the basophils. Cytoplasmic basophilia is going to increase early as you have a lot of Ruffyar and Golgi synthesizing these granules, and then as the cells mature, the cytoplasmic basophilia is going to decrease as the staining characteristics are going to be more prominent due to the granule content. The cell size will decrease, and a clinical correlate. I'd like you to think about, what does a left shift signify with respect to a differential blood cell count or a bone marrow count? What would a left shift signify? This table is just meant to help you consolidate your studying with granulocyte maturation. You'll find this table in your course handouts. Some of the key things you want to look at as you consolidate your studying would be characteristics of the nucleus. The nucleus becomes more pycnotic as the cells mature. The number of nucleoli decline. You can look at the nature of the chromatin as the cells mature, and then also look at the granule content as the cells mature. Let's finish up this podcast talking about erythropoiesis. Erythropoiesis, again, a very active process. 200 billion red blood cells per day can be produced by the bone marrow. That's 2 million, 2 times 10 to the 6th cells per second. That's 7 kilograms of red blood cells per year from the average person. That's a huge number of red blood cells. Erythropoiesis is stimulated by heat, by androgens, and by erythropoietin. Erythropoietin is a 34,000 Dalton glycoprotein. It's produced by endothelial cells in the peritubular capillaries of the kidney. We'll talk about that when we talk about the kidney much later in the course. Erythropoietin synthesis may be stimulated by oxygen sensors in these peritubular capillary endothelial cells in the kidney. Not only does erythropoietin stimulate erythropoiesis, but it also stimulates the release of red blood cells from the bone marrow. We believe that erythropoietin tends to reduce the thickness of the endothelial cells, thus increasing their permeability, making it easier for red cells to diapedese out of the bone marrow into the sinusoidal capillaries. If we look at the mitotic or synthetic phase for erythropoiesis, would be talking about not only cell division, but synthesis of hemoglobin on free polyribosomes. And the first cell you might be expected to identify in the erythroid series would be a basophilic erythroblast. A basophilic erythroblast has a fairly high nuclear to cytoplasmic ratio. It has an intensely basophilic cytoplasm due to the large number of free polyribosomes. The basophilic erythroblast will then continue its division and will mature into a polychromatophilic erythroblast. Here, nucleopycnosis increases. You'll begin to see a checkerboard pattern of the nucleus. The cytoplasm will begin to take on a gray-green color due to a mixture of free polyribosomes and an accumulation of hemoglobin. And as the polychromatophilic erythroblasts mature, the color of the cytoplasm will get more towards the color of red cells. So it's going to take on more of a grayish color. Notice the cells get smaller and the nuclei get more condensed or more pycnotic. The post-mitotic phase of erythropoiesis, essentially you are losing synthetic activity and you lose polyribosomes. There's an increase in nucleopycnosis, and ultimately the nucleus itself will become ejected from the cell. And so the more mature cells in the erythroid series would be the orthochromatophilic erythroblasts. The nucleus condenses to a fully pycnotic state. It's finally lost at the reticulocyte stage, and you see an increasing eosinophilic nature to the cytoplasm as more and more hemoglobin is replacing the free polyribosomes. And here you can actually see the nucleus being ejected from a reticulocyte. Here you can see some of the early stages of the erythroid series. This would be a very late basophilic erythroblast, then some polychromatophilic erythroblasts, this one being the younger of the polychromatophilic erythroblasts, this one being the older of these polychromatophilic erythroblasts, and I'm making that determination based on cell size and on nucleopycnosis and on the appearance of the cytoplasm. In this more mature one, you're beginning to see the cytoplasm getting a closer shade to the color of the red blood cells. Here, some orthochromatophilic erythroblasts, the cells very close in color to the color of the red cells, the nucleus themselves very highly pycnotic. This cell, I don't know what it is. Here's a mature neutrophil. This cell, I don't know what it is. This is probably in the erythroid series, but the cell is ruptured. It's a little bit hard to identify with certainty. This is an earlier cell in the erythroid series, most likely a very late stage basophilic erythroblast. How about a summary of the trends for erythropoiesis? Nucleus size decreases, nucleopycnosis increases. Finally, the nucleus itself will be ejected. The cytoplasm in the early stages is strongly basophilic. As the cells mature, the cytoplasm will have a mixture of basophilia and eosinophilia. The more mature cells, the cytoplasm is strongly eosinophilic as the free polyribosomes are replaced by more and more hemoglobin. With respect to cellular biochemistry, erythropoietin receptor synthesis precedes transferrin receptor synthesis. This precedes the synthesis of spectrin, and spectrin precedes the synthesis of hemoglobin. Cell size decreases in erythropoiesis. A clinical correlate, I'd like you to know what normal red blood cell counts are. You should appreciate what the mean corpuscular volume is, and you should appreciate what a left shift would mean. In the erythroid series, we asked you to understand what a left shift was in relation to the granulopoiesis. We'd also like you to understand what a left shift is with respect to the erythropoietic series. And I think you should be able to figure this out. A left shift is saying you're getting more younger cells. So perhaps there is some pathology which is requiring the synthesis of more white cells, perhaps an infection, or something going on with red cells, more synthesis of red cells. Maybe there's an anemia or some type of hemolytic disease, and so the bone marrow is having to put out more younger cells. Sometimes you can see the younger cells in peripheral blood. Here is a table to help you consolidate your study with respect to erythrocyte maturation. And you have this table also in your course handout material. So again, you can look at what happens with respect to the nucleus and what happens with respect to the cytoplasm. Here is a diagrammatic overview of hematopoiesis. So the pluripotent stem cell, which you're not going to be able to identify so readily, and we won't expect you to be able to identify that, but you should be able to identify the progranulocyte series. You can see these non-specific granules in the cytoplasm, and you can see several nucleoli within the nucleus. Then you can identify the myelocyte, either as a neutrophilic or an eosinophilic myelocyte based on the characteristic staining property of the specific granules. You might still see a nucleolus. You should see a Golgi halo. And then you'll see the metamyelocyte, either neutrophilic or eosinophilic metamyelocyte based on the staining characteristics of the specific granule. You'll see the indentation of the nucleus. The band cell for the neutrophil series, you'll see long parallel arms. You may or may not identify the band cells in the eosinophil series. You won't have any trouble identifying mature eosinophils and mature neutrophils in the bone marrow. Again, we're not going to ask you to identify anything in the basophil series in bone marrow, nor will we ask you to identify anything in the lymphoid series in bone marrow. With respect to the red blood cells, the earliest stage that you would probably be able to identify in bone marrow would be the basophilic erythroblast. You'll then be able to identify polychromatophilic erythroblasts. The nuclei will become more pycnotic. They'll take on a checkerboard type appearance. The cytoplasm will begin to start picking up a grayish tone as hemoglobin is synthesized. The orthochromatophilic erythroblasts, the nuclei become more and more pycnotic, and the cytoplasm takes on more and more of the color of the red cells. Finally, the nuclei are extruded, and you have the reticulocyte. Reticulocytes are not easy to identify unless you use special stains to identify some of the organelle remnants. Finally, let me say a few words about platelet formation. Platelets are formed from megakaryocytes, and megakaryocytes are produced by DNA endoreduplication without either karyokinesis or cytokinesis of the megakaryoblast. I'm not going to ask you to identify the megakaryoblast, but you certainly will be able to identify the megakaryocytes. These are very huge cells, up to 100 microns in diameter. They may be between 16 and 64 C with respect to DNA. So they have very large polyploid nuclei that exhibit multiple lobes. Platelets are actually fragments of megakaryocytes. They form when smooth ER within the cytoplasm fuses with the plasma membrane infoldings. And believe it or not, one megakaryocyte might break off between 4,000 to 8,000 platelets. Here is a megakaryoblast. Again, I won't ask you to be able to identify that in bone marrow, but clearly the megakaryocytes shown on the bottom are very easy to identify, and the cartoon in the upper left just shows the platelets that are breaking off of the megakaryocyte in the bone marrow.